You're at dinner, mid-sentence, mid-bite, and then, hic. Everyone laughs. Someone tells you to hold your breath. Someone else swears drinking water upside down is the cure. It's the most harmless interruption a body can produce. Mildly annoying, mildly funny, gone in a few minutes. Nobody at that table is worried. Nobody has ever been worried. But here's what almost nobody knows. Under the wrong circumstances, that same
Before the slurred speech, before the numbness, before anything else your body would normally use to raise the alarm. So the question isn't really, can hiccups kill you? That framing's actually a little misleading, and we'll get into exactly why later. The real question is stranger and a lot more interesting. What is a hiccup actually doing inside your body? And why, in rare but very real cases, does it refuse to stop, even when doctors throw everything they have at it? Because a hiccup isn't just some random glitch. It's a full neurological event, wired through some of the same nerves that control your heartbeat, your swallowing, and parts of your nervous system. And as you're about to find out, these are parts of your nervous system you didn't even know were connected to your diaphragm. To understand how something this small and this ordinary can turn into a warning sign doctors take seriously, you first need to understand what a hiccup actually is and where in your body it really comes from. A hiccup is not one event. It's two events happening almost instantly, back to back. First, your diaphragm, the sheet of muscle sitting beneath your lungs that controls your breathing, spasms. It contracts suddenly and involuntarily, like a muscle twitch you didn't order. A fraction of a second later, your vocal cords slam shut in response. Cutting off the sudden rush of air, that collision, air hitting closed cords, is the hic you hear. You're not choking. You're not gasping. You're witnessing a tiny, involuntary reflex arc complete itself in real time. That reflex runs on wiring most people never think about. The signal travels along the phrenic nerve and the vagus nerve, two nerves that start up in your brainstem and run all the way down to your diaphragm. This is important because it means a hiccup isn't a stomach problem with a side effect in your chest. It's a brainstem to diaphragm circuit, and the brainstem is not a place you want misfiring. And this circuit is stranger than it looks. Tucked inside your ear canal is a branch of the vagus nerve called Arnold's nerve. Stimulate it, say by cleaning your ear a little too enthusiastically, and you can trigger a hiccup. Not because your ear and your diaphragm are related in any obvious way, but because they're wired into the same nerve pathway. Your body built a shortcut, and most people go their entire lives without ever noticing it exists. Here's something else almost nobody knows. This reflex didn't start in adulthood or even childhood. Some researchers now believe fetal hiccups, the ones babies have in the womb long before birth, aren't random either. They may be rehearsal. It's a way for a developing fetus to practice the exact motion of breathing and to train the reflexes that will protect its airway the moment it takes its first breath. If that's true, the hiccup isn't a glitch in your system. It's one of the oldest reflexes you own. So under normal conditions, this is harmless. A few minutes, maybe an hour at most, and the circuit resets itself, which is exactly why almost nobody questions it. But that circuit doesn't always reset. Doctors actually have a name for what happens when it doesn't. Hiccups that last more than 48 hours are classified as persistent. Cross 1 month, and they're reclassified as intractable singultus. This is a formal medical diagnosis. Most people go their whole lives assuming hiccups are just hiccups. They don't know hiccups have their own clinical taxonomy, their own threshold, their own place in medical textbooks as a genuine symptom of underlying disease. And that threshold matters, because past it, hiccups stop being a nuisance and start being a signal. In documented case reports, brainstem strokes, specifically infarctions affecting the medulla, have presented with intractable hiccups before any other neurological symptom appeared. Not after the slurred speech, not alongside the numbness, before either of them. In some of these cases, it was the brain's earliest warning, arriving before doctors had any other reason to suspect a stroke was happening at all. It gets stranger. In one pediatric case, a child was brought in with hiccups that would not stop. Along with a heightened reflex response and visible twitching of the tongue, doctors eventually traced the cause to a tumor sitting at the base of the brainstem. The hiccups weren't the disease. They were smoke rising from a fire nobody could see yet. Even tumors considered relatively harmless can hide this way. A cerebellar hemangioblastoma, a slow-growing, typically non-cancerous mass, has been documented presenting primarily through intractable hiccups. If a doctor isn't specifically looking at the brain, that tumor can go unnoticed for years, disguised as nothing more than a stubborn case of the hiccups. And it's not only what hiccups reveal, sometimes it's what they physically do. In one case, tied to a brainstem lesion, the relentless cycle of hiccuping caused a severe esophageal ulcer from reflux esophagitis. The reflex itself, repeated thousands of times without stopping, was tearing at the patient from the inside. Then there's the version that doesn't announce itself through nerves or tissue damage at all. It just quietly starves you. A 62-year-old dialysis patient developed hiccups so severe and constant, tied to bronchopneumonia, his oral intake dropped. He simply couldn't eat properly anymore. This is the part almost nobody considers. Hiccups rarely kill directly. They kill by taking away your ability to eat, sleep, or recover, one interrupted meal and one sleepless night at a time. And in the most extreme documented cases, all of it can converge. One patient with a rare brain tumor developed hiccups alongside worsening drowsiness and hyperventilation. Despite steroid treatment and immunoglobulin therapy, the condition progressed, and the patient ultimately died. Which reframes the entire question this video opened with. It's almost never the hiccup itself that kills. It's what the hiccup was trying to tell you, and how long it took anyone to listen. So how do you actually tell the difference? A normal hiccup fit and a genuine warning sign don't look the same, and doctors don't guess. They watch the clock, and they watch for company. A few minutes of hiccups after a fizzy drink or a rushed meal, completely normal, gone before you've thought twice about it. But hiccups that stretch past 48 hours, especially alongside trouble swallowing, unexplained weight loss, chest pain, or drowsiness that doesn't lift, that's the point where a reflex stops being a joke and starts being a symptom worth investigating. And treatment for the stubborn cases isn't always what you'd expect. In 1988, a doctor published a case report documenting a genuinely strange fix: digital rectal massage, used to stop intractable hiccups by stimulating the vagus nerve. It worked. It was real peer-reviewed medicine. And it was strange enough that it later won an Ig Nobel Prize, the award handed out for science that makes you laugh and then makes you think, which, honestly, sums up hiccups better than anything else. So back to that dinner table. The laughing, the held breath, the water trick, the same scene almost everyone has lived through without a second thought. And for the overwhelming majority of people, that's all it will ever be. A blip. A few seconds of muscle doing something strange before it resets itself. The same reflex a fetus practices in the womb months before it ever takes a breath on its own. But every so often, in a small number of documented cases, that reflex is the first and only message your nervous system sends before something far more serious makes itself known. Not loud, not dramatic, just a small, repeating interruption, easy to laugh off, easy to ignore. The next time someone hiccups across the table from you and everyone starts laughing, you'll know what almost nobody else at that table does. Sometimes the joke is just a joke, and sometimes it's your brainstem trying to get a word in.